Hello everyone, I'm Dr. V. Mohan, Chairman of Dr. Mohan's Diabetes Specialty Center and Madras Diabetes Research Foundation in Chennai, India. I'm here at the ATTD meeting in Florence and I'm presenting some of our work done in India. So the session that I'll be talking in and my topic relates to how to deliver world-class diabetes care in under-resourced settings, remote areas, and how we can use technology to deliver this. So I'm giving several examples. One is our rural Chunampet Rural Diabetes Project, where using telemedicine, not now, not after COVID, but even some 15 years ago, we started using mobile vans to go around to various villages, carrying all the equipment with us. That means hundreds of villages can be covered using this model. And this model became very successful and it was repeatedly shown on Discovery Channel and BBC and Le Monde, French newspaper in France, and many other forums. So, and the Lancet published this as the model for rural diabetes care. The second technology which that we are using is within our whole chain of the diabetes centers under the Dr. Mohan's group. There are remote areas where there are no ophthalmologists. So we actually pioneered again using a very low cost made in India retinal camera with artificial intelligence already built in, so that a diabetologist, a dietitian, a technician, anyone can take pictures of the eye, send it to our base hospital, and within 30 minutes, the ophthalmologist can send the report back, whether it's normal or whether it needs any treatment or whether it's background retinopathy which just needs to be followed up, that's non-proliferative retinopathy, and so on. This model has worked very well. We have used this model in more than 100,000, more than 1 lakh diabetic patients, and it has been published and extensively shown how even in places where there are no ophthalmologists, if you have somebody who can just take a picture of the retina and send it to a reading center, a diabetic center or an ophthalmology center which has facilities for grading, you can then serve millions of people, because today there are 101 million people with diabetes in India. And how do you examine their eyes every year? It's a tall order when they have limited number of ophthalmologists confined to some metropolitan and other cities. You don't have such services. So using technology, you can do that. The third thing that I'm presenting in my talk is to show how precision medicine is not just for rich countries. For example, I'm showing how neonatal diabetes, using a simple genetic test, which is very inexpensive in India, and we are able to do it, and we're even doing it free of cost for those who cannot afford. Using that, how children who are wrongly diagnosed to have type 1 diabetes, we can make a correct diagnosis of neonatal diabetes and stop insulin in them and treat them with a very inexpensive sulfonylurea tablet, which can be completely game changing as far as they are concerned. And this part of it I'm presenting for the first time at this ATTD meeting. So in summary, although we have large problems of magnitude of the number of people with diabetes in many of our countries like India and so on, using technology to leverage our treatment, we can plan in such a way that everybody, whether they are in rural areas, in underserved places, or in less developed states or regions of the world, we can still deliver very high quality diabetes services at very low cost. And that is the main message of my presentation at this ATTD meeting in Florence. Thank you very much.